Apparently, using Ozempic will make your muscles shrivel up like an old raisin and age you 20 years in just a few months. At least that's what you're being told. But is that the reality?
And Ozempic was not originally intended as a weight loss drug, but many people use it for this reason due to its appetite suppressing effects. One of the side effects is you feel like you're full. And it works by helping people feel less hungry and they actually consume fewer calories. But here's the reality. Ozempic is not ideal for weight loss long-term because you're losing more muscle mass. And listen to this long-term medical study. Clinical studies have shown that these drugs like Ozempic and Wegovy, also very similar drugs like Mounjaro and Zepbound, have shown that significant weight loss can come at the expense of muscle mass. In particular, participants that were included in a trial that lasted between 68 and 72 weeks lost 10% of their muscle mass, equating to approximately 20 years of age-related muscle decline. Now, I want you to think about this. If you're taking a drug like Ozempic or Wegovy or Mounjaro or Zepbound, you are aging your body possibly.
Losing muscle while losing weight is a real thing. But blaming Ozempic for it, well, that's like saying treadmills cause knee injuries because somebody used them wrong. Let's cut through the noise and talk about what's really happening. The claim here is that Ozempic ages your muscles by 20 years in just a few months. What's real is that if you are not resistance training, you lose muscle. If you lose weight fast and you don't lift weights, you'll lose muscle. Guess what? That happens with Ozempic, that happens with fasting, that happens with just eating 1,000 calories a day. In fact, there used to be a term, it's called Forbes rule, and the expectation was that you would lose 25% of your muscle. And what that rule says is that 25% of your weight loss is muscle. Fortunately, he actually did leave links to references in the video description, and because he did not say exactly which study he's referring to, but there's a lot of links. What he's claiming about the aging of muscle is not what the article claims. There's zero evidence that Ozempic uniquely ages your muscles. Actually, there's evidence to the contrary, just that rapid weight loss can include muscle loss if you don't train properly. That's what the takeaway is. And what he does get into later in the video is talking about strategies on preserving muscle. In fact, actually, this is good advice. In fact, if you eat enough protein and you lift weights, you can hold on to muscle while burning. And a number of studies have shown you could spare or turn that loss in half as far as the muscle loss, or even negate it. I've seen some studies on elderly patients that all but blocked the muscle loss. Your muscles are not just disappearing into the void because of a GLP-1 medication. If you're taking Ozempic, the answer is not panic. The answer is picking up some weights and eating some more protein, the same way that you would do with any weight loss plan.
The amount of muscle mass you should have, or the amount you're losing that period of time, is the equivalent of aging your muscles 20 years. If you're taking this drug and you're 40 years old, you now have the body of a 60-year-old because you've taken this drug. And this muscle loss has raised concerns among even the most notorious health experts, people like Peter Attia, Gabrielle Lyons, and many others. And these are medications that actually target your body losing not just fat, but also muscle. So when we break down this clinical study, what you find is that patients that took this semaglutide drug lost close to 38 pounds. However, 15 to 16 pounds of their weight loss was due to losing muscle mass. Think about that, losing 15 to 16 pounds of muscle. 40% of the weight loss is muscle. And what they found is that if somebody were just losing weight by maybe walking more, eating a little bit better over time, they would only lose about maybe 25% of muscle max. However, and there are some cases, and I'm going to teach you how to do this today, if you do it the right way, you'll lose maximum to 5 to 10% of muscle, along with losing way more body fat.
This is one thing I did want to point out on this video, besides the Ozempic thing, is that this clip we just watched is what we call a false dichotomy. It's a classic either-or choice. As if you only have two options. You can either just eat better or inject yourself with drugs and do nothing else. Well, some people's bodies fight against weight loss harder than others, whether it be insulin resistance, leptin resistance, you have some type of metabolic issues, whether it's frank diabetes or something else going on. And it makes it very difficult for people who want to lose weight, and then you just say cut carbs and exercise more. Doesn't necessarily always work for them. What's the reality? Ozempic is not a magic bullet, that is for sure. It's a tool. The best weight loss strategies do include nutrition. They do include exercise and medication when necessary, and certainly they include behavioral changes. Shaming people for using medication is like telling someone with glasses to try to see harder. It's gonna work. The takeaway is weight loss is not a moral purity contest. If you need medication to reset your metabolism, if you can do it with diet alone, great, do that. The goal isn't to do it the right way, it's just to get healthy. And now, he did say this at the onset that he's just talking about the downsides of Ozempic, and it's a little bit scary, the things that he mentioned, particularly, aging 20 years, that would scare me and make me not want to use it too. Now, that said, there are benefits to using this besides losing weight. And it's certainly true that it was created for diabetes, but it's also true that a lot of medications that start out as one thing get used for something else. Like Rogaine is probably one of the biggest ones. It was initially created for high blood pressure. Turned out it had the side effect of growing hair. It's used way more for hair growth now. Viagra, used for erectile dysfunction, now is also that class of medication used for pulmonary hypertension, which did not have a lot of choices 20 years ago. It still doesn't have a whole bunch of choices, but it's certainly been helpful. Now, one of the things that I said this a while ago around diabetes medications, that it has to show cardiovascular benefit for them to approve it. Meaning it has to show that people have less heart attacks, like it's good for your heart, or decreases your risk of strokes. There was a trial in 2023, it's called a SELECT trial. This trial showed that a 20% reduction in heart attacks, strokes, and cardiovascular deaths in people who were not diabetic. If Ozempic were a pill but didn't have this weight loss stigma associated with it, it'd be celebrated as a medical breakthrough. Now, that's not just the only benefit. For heart failure patients, there's at the lowest level that we see that there's less hospitalizations for people who have heart failure when they're on GLP-1, as well as improved cardiac function. That's not bad, I don't think. Kidney function, there are a number of studies showing how GLP-1s protect against kidney failure and people who have diabetes. I think that's a good thing too. I could keep going with all the other non-weight loss related benefits and studies that are going for other indications, but I'll just do those three. Now, the other thing that our GLP-1s in general are going to do besides, yes, they're going to decrease your appetite, but also they're going to change how your brain responds to food, particularly for cravings for ultra processed foods, which the vast majority are no good for you. Instead of relying on willpower, your biology actually starts working and works with you instead of against you. If a drug improves health, if a drug improves heart health, kidney health, and helps break cravings, why is it allowed this conversation around muscle aging? Or, I don't know. Well, let me know in the comments if you did fall for one of these myths before. Just addressing a couple myths. The other big part of this video is like how to vet or decide if health information is one, right or wrong, but particularly for you. One of the first things you want to look at, step one, would be who stands to gain from this information you're sharing. And that doesn't mean to say that someone sells supplements or they have a course or a book like that immediately negates it. Not at all. Just be mindful of that. Or are they open to hearing the evidence, or are they married to just this is it and that's the only way to go? Step two would be look at the actual studies. And this is actually probably the hardest part, is like, yeah, you actually got to go find it. But one tool you can use is Perplexity, and just ask for what is the research on whatever topic it is. Sometimes people will provide you with a study, go look at it and see what the researchers or conclusions were. Sometimes they don't always match. So like this muscle loss one, and they didn't mention anything about the muscle aging. They mentioned that the amount of muscle loss is equivalent to 20 years of normal aging. Step three would be, what are other people saying? Is there any expert consensus around this, like the American Heart Association or the American Board of whatever society? Now, I will say that's not the end-all be-all. There's certainly other avenues to look at, but sometimes there's not data for something, and so you just have to see what other people in that space are saying. And you kind of have to decide for yourself. A step forward would be mindful of absolute claims. If they say this drug is bad for everyone, or everyone should take this, that's a red flag. Also look for, clickbait pattern. If it's something that sounds extreme, you definitely want to look at second and third sources before you just believe it at face value. If you get any message that sounds scary, which immediately, I won't go down a rabbit hole, but if you get a message that's more based around fear than data, you should question it. Now, that said, I think that's probably about 5-8 minutes where he talks about Ozempic. The rest of the video is really good. I think a lot of the recommendations you make are very good. One thing I certainly agree with is this high protein diet. Leveling up your protein is going to have a dramatic effect on maintaining muscle. Now, if you pair that with strength training, voila, we're really going to be cooking with gas. Those two things, I certainly want to do. We really should ideally focus on our metabolic health and not just eat less, move more. We really want to work on metabolism. And remember that medication's a tool. It's not doing the work you are. Just use it as a tool, part of everything else you're doing. Losing weight is about sustainability, body composition, and long-term health, not about following whichever natural method somebody tells you is morally superior. Let me know in the comments if you got any other questions on this or you want a deeper dive on this topic.